And with that, I want to introduce our speaker, Tammy Arndt. Tammy and I go way back many years, so I'm really delighted that she was able to come and join us today and present. She's the director of Northwest Telehealth, which is a division of Inland Northwest Health Services and an affiliate of Providence St. Joseph Health. And she facilitates and supports healthcare administration, distance education, and clinical program delivery to improve access to services throughout the region. With 20 plus years experience in the telehealth industry, Tammy has facilitated the successful launch of multiple telemedicine programs, extending care to rural hospitals, clinics, and patient homes. She is also the 2018 recipient of the Washington Rural Health Association's Mary Selecki Friend of Rural Health Award. And she is a current board member of the Northwest Regional Telehealth Resource Center, representing Eastern Washington.
Thank you, Cara, and happy Friday to everyone. I really appreciate being invited to share my experience with the virtual care delivery to the patient's home. Most of our experience has been with Zoom, which we started using in 2016 as a solution for desktop video conference participants to add them to our existing conferences hosted via our video conference bridge. But in 2017, as we began to understand the tool a little bit more, we expanded our use case and began piloting direct-to-patient follow-up care at Providence locations in Spokane, which is where I am located, as well as Portland. And then due to the success of those pilots over the year, in 2018, we assisted Providence with the integration of Zoom, and they eventually integrated it with Epic as their solution for direct-to-patient care. So they were, ahead of the curve as far as exploration and their ability to pivot at the result of the pandemic to make sure that people could continue receiving care. Need to click the slide. So session objectives for today. I'd like to review the technical requirements for virtual care. I think that's an important piece of success when you're talking about going into someone's home. Provide some guidance for evaluating the patient's capacity to receive the virtual care and how to best facilitate the patient experience. So just a little bit about my perspective, so you know that kind of the experience that I've had and the kind of diversity of locations. Northwest Telehealth, again, is a division of Inland Northwest Health Services. We are an affiliate of Providence St. Joseph Health. We'll be joining Providence in January. And as a regional video conference network in Eastern Washington, we've been providing services for about 25 years now. So we provide a collaborative platform for healthcare administration, like Cara mentioned, medical education and clinical programs, such as ambulatory and direct-to-patient telemedicine services. And then as a member of Providence Healthcare, we provide conference services and support to their affiliates in the Washington, Montana region and serve critical access hospital and rural health clinics in Eastern Washington. So I say all of that because what that really means is we have a really diverse background in not only distance education, but just how best to promote and implement services via video conference. That telehealth has been around for many, many years. There were all sorts of reasons as to why it wasn't implemented to the degree that it was now. But definitely we've learned a lot of lessons through the years about people, about process, and about technology. So I come from it just not from the clinical perspective, but also the kind of distance education perspective. So with the unexpected onset of COVID, healthcare organizations did have to quickly pivot and plan for safe delivery of care to the home. As the shelter-in-place orders took effect, technology and workflows had to be stood up quickly for both providers and patients to maintain continuity of care. Regulatory rules pertaining to telehealth delivery and reimbursement were relaxed to allow access during the pandemic, which is why currently we are able to use telephone services and be reimbursed for that, because historically it was always a synchronous connection, which was two-way audio and video. But now as cases are surging nationwide and especially also here at home in Washington State, it's clear that telehealth plays a vital role in healthcare delivery now and in the future. So I think we were fortunate because advances in consumer technology made direct-to-patient care possible, which it maybe wouldn't have been before if the pandemic had hit 5 or 10 years ago. But now we're facing a hybrid model, right? Patients in the clinic, patients at home, and urgent care, the hospital setting, and we're tasked with providing the right care at the right time in the right place. So when we think about emergency preparedness in a pandemic, right, it's prevention, protection, mitigation, response, and recovery. And now that we've had a moment to kind of digest what has happened and accept our new virtual environment, we have an opportunity now to identify and invest in best practices for care delivery. So to do this, we need to assess the following. So one is identify a patient type. So is your patient a good candidate for virtual care? And then what are the consult requirements and can they be completed via video? So is the service and provider type approved for virtual care? And what is needed for billing and reimbursement? And so for example, if vitals were a requirement for the services, could you do that at home? And would that require patient monitoring tools to satisfy that requirements? And are patients willing to invest in the technology and take a more active role in their health, right? So that's part of the adoption of telehealth and making sure that we can do this. Documentation, again, for Washington State, there's a consent rule, right? So the patient needs to consent that they receive telehealth services, which is often then noted in the medical records. And then requirements in billing to denote a virtual versus in-person encounter. And then for billing, what codes and modifiers and place of service codes are required in order to do the billing, right? So that's a big piece of it because we definitely want to be paid for sustainability of our programs. And then the technical capacity, right? Considerations for the provider and for the patient. And then lastly, although it's not on here, is metrics. So what kind of benchmark measurements will we implement to monitor the success of our programs and the quality of care that we're providing? So when I think about this, I think about 3 buckets for development of workflow for virtual care, right? So assessment, identify the scope of service and the technology requirements for the service to occur. That's kind of step 1. And then the second thing is to evaluate the patient's capacity to receive virtual care. I just think in my experience over the last year for sure, if not several years, it's not a, if I have the technology, patients will be there and be able to do it. It's a two-way street. It's a dance, right? Can they live up to their end of this process so that we can deliver care in a reasonable and safe manner? And the last thing is to facilitate that and manage that experience for both for you as clinicians and for the patient. So I have to talk about HIPAA considerations. It's my job. So when delivering care virtually, it is important to address the privacy and security measures to ensure HIPAA compliance. I think people just say, well, it says it's a HIPAA compliant software, and that means that it's good to go. That's not really true because HIPAA requires a business associate agreement with the vendor, which establishes a relationship to report breaches. So it may be HIPAA compliant, but you're not HIPAA compliant unless you have that BAA. So definitely making sure that you have a relationship with the vendor establishes that for security and risk. So all collaborative software, I don't care if it's Zoom or MS Teams or WebEx, whatever it happens to be, they all have features that can be turned on and off based on the use case. So most of us, including me, are managed users that live under an IT platform, and they provide administrative oversight for network security, right? What can we and cannot we do with the software and the tools and the technology that we're provided? So when configuring a license for healthcare, it's important to turn off and lock certain features like cloud recording and limit data center transit to ensure privacy. And other feature controls are at the discretion of the user and include like password, waiting room, and locking the conference. I think this is from the IT perspective and from risk, this has been the most important part of using collaborative tools that everyone is using. They're using it for school, they're using it for meetings, they're using it for healthcare. Here we are all of a sudden in this virtual world, and as a user, I have a license and I have the ability to configure that license and what I turn on and off and how I manage the software literally based on use case will determine the success that I have. So when you think about that, it's important to establish some kind of protocols, right? So overall, to deliver services in a kind of HIPAA compliant manner, you'd want to make sure that you're consenting the patient for the consult prior to the consult actually occurring, and you're documenting it. Now, this can be an individual unique form. It could have verbiage to an existing consent form, but you want to make sure that you've addressed that piece. So for scheduling, as we know, software has a variety of ways to be scheduled. You could create a unique link for an appointment that you use specific for a date and time. You can schedule a recurring link, which I consider like a virtual exam room that's always available. It's the same link every time. You could do an EMR integration, which is you're scheduling within your EMR and maybe WebRTC or a video window pops up and you're able to see the patient that way. But one of the important pieces of this in terms of privacy is distribution of the link, right? You need to have a secure method to actually send the link to the patient. So secure methods are like a patient portal, for example, is secure because somebody has to do a username and password to log in. You also can send it secure email, but then again, somebody has to create a username and password to get it. You could use personal email, but you need written consent for personal email. And the reason why is that's actually considered an unsecure form of electronic communication. So be careful how you're distributing links and how people are accessing them. So speaking of that link, I like to think of it as a virtual exam room, right? So in here I say, keep the door closed because we would never leave an exam room door open during a patient consult in a clinic. And the same should be the requirement when delivering virtual care. So always remember to close the exam room door, which in the case of software is achieved by enabling a waiting room or locking the conference. So we just need to think of our virtual space as an extension of our clinic, and we need to act accordingly. So again, the distribution of links is key to ensure the privacy. And I think we've all learned the lessons that the Zoom bombings pretty much occurred because people were doing poor link distribution management. They were placing their link on social media or someplace on a website where anybody could click on it and anybody could enter a meeting room. A lot has changed for Zoom and a lot of softwares as a result of so many people using the technology, which is why now you see those controls at a user level to create a waiting room or to lock a conference. So in terms of actual technology for direct-to-patient care, right, we need to have internet access, so wired or wireless to support two-way audio and video. Again, I know that with COVID, we can use the phone and video isn't a requirement, but historically it has been. And I think that for behavioral health, I'm assuming that, you know, seeing somebody is an added value to how you do your work and the consults that you provide. So we do need to have a device capable of using interactive technology. The requirement has been a camera with a microphone, speakers or a headphone like what I'm using, a display so that you can see what you're doing, and then video conference software. So, you know, having said that, again, that is a piece of the pie, but it's not where the rubber meets the road. Where that occurs is really in the process of how you're going to deliver the care and what is going to happen in terms of getting the patient into the right place where you are in a safe and secure manner. So again, how will those patients access the link? Will it be the patient portal? Do you have secure texting and you put a link there? Can you do verbal instructions? So is there a landing page where you can say, go to this site and I'm going to give you a number to type in and I will meet you there. So all sorts of ways to be flexible in how you do it, but always with the thought that you need security and you need to make sure there's a good way to do that. So how will the provider access the link? We've had a lot of discussion over the last couple of years of what's the best way to do this and what is the easiest way to do this. So Zoom historically has said, you know, you are a license holder, you are the host, you have to log in and then you can go about your business. But There are other ways to do it. There are ways that within an EHR, maybe it is a linked into your license, and you just need to go into a single sign-on because your IT platform has created that environment where you can log in and then access your link from there. We have done a lot of desktop video conference icons, so we create this never-ending link. We create an icon that's named for the program that's using it, and then it's on the desktop. That's not emailing, that's not on someone's calendar. It's a location where people know they can go to enter their virtual exam room. And then again, a landing page is a location where you've created a website that has your information where somebody can join, both the provider and the patient join in the same location. So the other pieces of this is who's going to schedule the software and how will it be done? So again, as the provider, are you scheduling a consult environment where that virtual room is always available? Are you doing it specific to the patient? Are you scheduling? Is your office staff scheduling? Is it the front desk? Is it an MA? There's a whole variety of people who can have access to this software and how it's managed within the clinic. Because for me, it seems like the best way to do this would be to create an environment that's not so different from the way we are already providing care. The only difference is this actual clicking on a link to enter in something. And then, of course, because my company provides technical support, I think that's a really important piece of the conversation. Who's going to provide the technical support? Is it you as providers? Is it your office staff? Do you have a vendor? Do you have an IT person who's willing to do that? So again, just making sure that you're covering all the bases will be really important. So I gave this as just kind of an example of workflow, right? So for example, when we were doing the pilots for direct-to-patient care, we were working with a cystic fibrosis clinic here in Spokane. Now, these patients were compromised. It was hard for them to get to the clinic, and they struggled with actually no-show rates and things occurring. So we came up with the idea of a technology certification process where we would touch base with their patients ahead of time, and we would go through the paces of what they needed to do, test with them, make sure that they understand that their environment needed to be private, that they had the capable internet speed and everything to actually have a virtual consult. So what we found, after about a year of doing this, we made a list. So the clinic said, how many of you would be interested? How many of you have the technology? And would you be willing to do this? So our goal was to take this patient population, certify them for technology, help them with the process. And so then the clinician wasn't left with struggling with this piece of the conversation, right? People were ready and they understood and knew what to do and what was expected of them. What we found was that it isn't as intuitive as you think. Now, this was pre-COVID. It was pre the fact that everyone was using virtual technology. So I'm sure that the rates of success are going to be better today. But what I found is that based on the patient population, not only the age, but the kind of patient it is, how compromised are they? Where are they struggling overall? That also dictated the amount of time that you would need to invest in them as your patients to make sure that they were good and able to receive care. So let me just go to this next one. So as we went down the story, what we found was that, one, there were stopping points, right? Not everyone can do this. But that also people wanted a self-test option. We don't have the staff or the bandwidth to actually do something where we're reaching out to patients and helping them through this. So we developed a kind of a one sheet, right, that basically did our best to say, here's what you need in advance of your consult to get set up and ready to go. So the first part of this, I know it was hard to see. So the first part of this instruction sheet really identifies the technology needed and addresses how to access the software. My recommendation is always to address multiple devices because it's definitely a BYOD, bring your own device and software world, but definitely the device. So you need to be aware that if you're going to offer services that you have to be able to give them some options. And then the second half of this was really how somebody could self-test at home, right? So how fast or how good is my internet speed? Zoom, we identified, had a pretty low bandwidth, and that it actually kind of flexed depending on how somebody's internet was at home. But what you find out when people test speed or they're actually doing a consult is, are you watching Netflix? Especially today now, are your kids at home on school? How many devices are vying for that bandwidth in your house? And then you think about how many people, first of all, have poor connectivity or don't have the luxury of even having good internet speed at all, if at all, at home. And what's their chances of actually upgrading, right? So you have to say, okay, if you don't have good speed, make sure that everybody's off and that you go into a room where you've got good connectivity. There was one gal that we had a hard time with, and we realized her modem was far enough away in the house that if we got her to go closer to it, all of a sudden it resolved her speed. So that was, again, just little tricks of the trade. The other thing is to test your device. You probably all know this. You can click on a self-test and it will prompt you to test your microphone and your speakers, and you can see yourself. So really, how do I use this software? People are pretty good at it today, but it's always good to give them some kind of ideas to how to do it. The other most important thing, I think, is to make sure that at the bottom, let me just back up a couple. At the bottom, there's a space available for the contact information. Do not provide information without some way for somebody to contact and say, hey, I'm having a problem, because not everyone's going to be a good candidate for virtual care. So I wanted to talk for a minute about patient portals, right? So again, we work with Providence. There's MyChart, which is their patient portal. These are pretty popular because what it does is it's a one location where everyone can come and they can get prescriptions, they can ask for an appointment, they can see their provider, they can see their test results. I think the goal of portals makes a lot of sense because it really keeps you connected with the patient, and it's a place where everything can occur. It's not as easy to place links in portals if you don't have an integrated solution, but more and more now, especially, all portals are looking for some kind of a solution where they can integrate video, or they can at least within a chat box or a message location share information like where to click on a link. The other thing is that you need to make sure that if you're using a patient portal, you're still going to have the same challenges as if you're just providing a link in another sort of way. So for example, somebody still needs to create a username and password. They still need to be able to understand the check-in process, and they still need to be able to click on the link to make sure that they get to where the provider is. I think that the other thing is that you need to make sure that there is a way for somebody to cancel an appointment, who to call, what to do, or if you're stuck in a waiting room and nobody's coming, what to do next. So it's a good solution, but it doesn't come without its issues as well. So now I'd like to really talk about facilitating the patient experience. In my opinion, if you do this once as an investment in your patients and your practice, you'll be good to go, right? So you have to tell them, especially since not many people have experienced virtual care, what the expectation is, what the experience is like. So you want to orient the patient to the process and set the expectations for the experience, right? So for example, are you interested? Yes. Do you have the appropriate device? I do, right? Well, okay, first what we're going to do is we're going to send you home with a little training document. We're going to give you an ability to test your device and see if you're able to do it, right? And then not only does this build patient competence and confidence, and as providers, you can focus on delivering care and not providing tech support, but it really opens people's minds to the fact that they can receive care in a different sort of way. So the other piece I think that's important is the website manner. So, right, so you want to say a proper setting. So a proper setting is making sure that you have good lighting, that your camera angle is appropriate. You're not looking at a ceiling or off into a room somewhere, that there's some kind of identification, right? So for example, you can see under my picture, Tammy Arndt, Northwest Telehealth. If you're a provider, right, maybe you're showing your ID badge so that people see that you are who you say you are, if it's not somebody that knows you already. So I think that that is an important piece of it. You want to maintain eye contact and have some kind of conversational rhythm. You know, I think when it's hard conversations, there's that pregnant pause that you should be comfortable with, and I'm sure you are. So don't feel like you need to rattle on and fill up every moment, but you do need to have a cadence to the conversation and a way to bring people in and to feel like you are there for them and that they are close to you. You definitely want to respond to emotion, right? I'm sure I don't have to tell you guys that, but responding to emotion is good. And then you want some kind of a process for closing the visit. So to make sure that the patient has time to ask the questions and that they are addressed and that everyone understands next steps. So I think that if you pause and you imagine what it's like to receive care, then determining how to provide the care is again, it's a two-way street. It's a way for you to just say, okay, I understand what this is like, and this is how best we can do this. So I just wanted to kind of, in that same realm of kind of your brand or your clinic or your service, to realize that there are ways that you can kind of brand and make your space kind of more like the clinic than it is just in your living room. Because I think about today with virtual backgrounds, you know, and there's all sorts of ability to upload pictures. So what we have here is we have a couple of examples, right? So one is a vanity URL. So that just means that you're able to create a space, a virtual space where somebody can join a meeting or place a test call or go to. So when I think about having to direct someone on a phone on how to join where you are, this isn't a bad idea, because if it's something where the link isn't there and it's a more on-demand service, you could say go to nwth.zoom.us. When you get there, click join a meeting, and I can actually take my link and make a phone number out of it. Maybe the phone number is the same as the clinic, and I say enter now 509-232-8122, and I'll meet you there. So that's a great way on an on-demand service or a triage service to get somebody into a virtual call kind of right off the bat. The other thing is that you can create waiting rooms, which again, we all were in a waiting room. Well, I wasn't, you guys were in a waiting room before you joined the webinar, right? So you can definitely take that waiting room, and if you can create messages that go to the waiting room. If you make the meeting room the same as the title, Dr. Jones's clinic, or whatever, the name of the clinic or the name of the provider, when you enter the waiting room, you see that. And at least that is a way that you can, it's a way you can identify that, let the patient know that they've actually arrived in the space that they need to be, and they're not just in a waiting room somewhere. So again, I think Kimbo texted you guys or messaged you when you were in the waiting room that the meeting was going to start in several minutes. I think it's a best practice when a patient is in a waiting room and maybe you're not ready yet, to at least acknowledge they're there, right? And that could be the provider, that could be maybe an office staff person who is managing that piece of it. So again, just a recognition, when you walk into a clinic, you're greeted, right? There's somebody to say, oh, hi, Tammy, yes, the doctor will be with you shortly, or here's what we need to do to check you in. So again, I think that in a virtual world is possible. It just takes a little bit of extra effort to make sure that that patient understands where they are, and it helps you as an identified location. So then I think about the day of the consult, right? So there's the patient experience and the provider's experience, and each of them are asked to do certain things, right? So when we go to the clinic, it's the same whether it's virtual or whether it is in person. We have an arrival time. We need to understand where that is. Is there a copay? How will that work? And then again, what are the processes for checking in? A portal maybe gives you all the processes, check, 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 do all of your requirements for check-in. You know, if it's just a link, that isn't there. So are you seeing someone and you're asking them those questions and then recording it? And then the most important thing, I think, in the world of waiting rooms, which we live in today, is what if you're stuck in there, right? So what if I'm having technical issues? What if nobody came and I've entered the waiting room? What if I have to cancel my appointment? Just so that your patients understand the process, right? Call the clinic if you're having any problems. Oftentimes, I have found that clinics, someone in the clinic is calling the patient prior to the consult just to make sure that they're good to go and just to make sure that they're ready to go before the provider joins the call. And then again, for the provider perspective, right? What are we asking them to do? Do they need to log into the software? I mean, is it part clinic day in person and part virtual? Is it all virtual? How is this going to work? Where am I seeing patients if it's a virtual patient versus the in-person? I mean, some of the rural clinics have the cameras and the computers that they're using in an exam room, and then the providers actually rotate in. Sometimes it's in the provider's office. I've seen it done a variety of ways. So again, logging into the software, admitting the patient from the waiting room. Who is that? Is that the provider, or is it an MA or a nurse, depending on what the check-in procedures are prior to when the patient joins and the provider joins. Again, we went over that introduction and identification, what is needed to complete the exam and to document. Do I need dual monitors so I have charting on one side and the patient on the other? These are just the logistics. And I'll tell you, I think we've all experienced the onset of COVID meant there were a lot of people looking for technology in a short period of time, and it wasn't always available. So again, how do we get around those things, and how do we do the best that we can with what we have? So I wanted to kind of talk about options for homes that have no or poor technology. So we assume that everyone does, but the reality is they don't. And there have been broadband issues across the state, especially in rural sections of Washington. And I've been working with the Department of Health Rural Palliative Care Initiative, and they are talking about for palliative care services, especially like up in Okanagan, where the connectivity is so poor, how can we go and see the patient, right? Like, so driving is tough. We hope to use Zoom. We don't want to say that if you don't have technology, you don't get the services. So can you arrive with technology, or can you assign it? So one would be a palliative care staff member who has the option to connect back to the entire team, going and seeing the patient, and they arrive with a wireless device with a hotspot or some kind of cellular service. There's a reusable static link on that device. They act as the telepresenter, and then they have access to the entire team through that piece of technology that's brought to the home. What could it be? A home health aid? How does that work? Assigning technology to the patient, right? Again, would require a device that has some kind of cellular service, a reusable static link that they could click on. That would be patient or caregiver facilitated. And then again, they would provide access back to the palliative care team. So we've kind of explored these options and technology solutions to deliver care in this way, but know that there's not one shoe, not everything will fit, right? So I also wanted to note that the Department of Commerce has developed a free Wi-Fi map in response to the impact of COVID-19. So there are drive-up hotspots that provide free temporary emergency internet access for Washingtonians who don't have broadband services or access at their home. So it's a website with a mapping tool. You can click on it. There's the state. You can click on each little dot and it will give you a location. I think it's a great service as we work out the connectivity, because at least then if it's an actual, I have some kind of device, but I don't have very good connectivity, we can take care of that. So, you know, as we move forward, we have an opportunity to establish workflows that complement how we see patients in the office to improve access to the right care at the right time in the right place. My recommendation is that we replicate workflow as close to a clinic in-person setting as we can, and the only difference is location, and that would be the cloud. So in my opinion, my experience is just keep calm and telehealth on, because this is definitely here to stay. And we're not going back to a world where there isn't virtual care. It's part of the future. And I think that service to the home will only expand and grow. And it will become important that we develop processes and protocols for how best to do this so that everybody has a safe experience and that the care is meaningful and important.